Assalamu alaikum everyone, dear students and doctors. Today we will discuss a special topic that's necessary for every medical student and doctors. Our local institute is Central Asian Medical University, and it's continuing its work from the 2022. And my name is Mukharam. Our department is Basics of Pathology, and our today's lesson is acid-base balance. We should admit that it's quite a difficult topic to understand, but I try to show you straightforward way to understand and how to use these skills in the clinical settings. Okay, we will begin. In fact, acid-base balance is measured by pH. pH is a normal pH amount in our blood is around the 7.40, and if the pH below of the 7.40, it's acidosis, and if it's above from the 7.40, it is alkalosis. Acidosis means that there is high amount of acids, is hydrogen ion, and alkalosis means that there is not enough amount of hydrogen in our organism. Let's talk about the types of the acidosis and alkalosis. The types of the acidosis and alkalosis is the same. It's a metabolic and respiratory. Okay, and look at the metabolic acidosis is caused by some kind of metabolic changes in our organism. For example, it especially seen in the patients who are suffering from diabetes mellitus type 1 and type 2, and people who drink alcohol, their blood become acidosis. In the diabetic patients, the high amount of fatty acids accumulated in the blood, and in the patients who drink alcohol, the amount of acetic acid will accumulated in our organism. So the acidosis may occur in this kind of patients. That's the name is metabolic acidosis. In the metabolic acidosis, the hydrogen ion concentration in the blood elevated, and our another organ tries to compensate this condition. This organ's name is respiratory system. Respiratory system try to maintain the pH by eliminating the hydrogen ion by decreasing the amount of carbon dioxide in the blood. How this may occur? Respiratory compensation caused by the increasing the rate and increasing the depth of the respiratory system. By this way, we discharge more carbon dioxide to the air. As a result, the amount of hydrogen ions in the blood will decrease. Okay, that's a metabolic acidosis, and it is correction by respiratory system. Our next type of acidosis is respiratory acidosis. Respiratory acidosis is caused by, according to its name, by the dysfunction of the respiratory system and its regulation. In our next page of our presentation, we will talk about that. And due to the failure of the normal function of the respiratory system, the amount of carbon dioxide will increase in our bloodstream. The carbon dioxide is the precursor gas for the carbon acid, And when there's a correlation between the high amount of carbon dioxide and the high amount of hydrogen ions in our body. In this kind of situation, our another organ tries to help our organism to eliminate the acid from the body. That's renal compensation. Renal compensation means that our kidneys try to eliminate additional and unnecessary acids from our body. Okay, there is a communication between the organs. If the patient have some kind of renal disease, for example glomerulonephritis and oral lithiasis, in this kind of situation the acid-base balance will be damaged according to the loss of renal compensation. Okay, our next information is alkalosis. Alkalosis means that there is not amount of normal amount of hydrogen in our blood, and as I mentioned above, there are two types. The first one is metabolic alkalosis and second one is respiratory alkalosis. The metabolic alkalosis is especially caused by some kind of situation that the patient lost the hydrogen ion. Okay, it may be vomiting and some kind of using of diuretics. As a result, the normal amount of hydrogen ion will decrease in our organism. And in this kind of situation, it is quite exciting that other organ will try to help our organism. This organ's name is lungs. It's respiratory compensation. When the amount of hydrogen ion decreases, our respiratory system tries to increase its amount, to normalize its amount by decreasing the respiratory system function. Respiratory system function when decreased, the amount of carbon dioxide will increase in our bloodstream. The carbon dioxide means that there is a hydrogen ion. Okay, there is a hydrogen ion, and when the hydrogen ion elevated, it tries to maintain the normal pH amount in our organism. Okay, that's metabolic alkalosis. And the next one is respiratory alkalosis. Respiratory alkalosis means that when the patient intubated by the anesthesiologist and the hyperventilation is performed by the anesthesiologist, the respiratory alkalosis may occur due to decreasing the amount of carbon dioxide from the bloodstream. Okay, and in this kind of situation, of course, our kidneys always ready to help to respiratory alkalosis by decreasing the discharging of the hydrogen ions from the kidneys. By this way, the renal compensation may occur and the acid-base balance will be normalized. Okay, and let's talk about the causes of the respiratory acidosis. Okay, and the respiratory acidosis, as I mentioned above, is caused by the dysfunction of the normal function of the respiratory system. There are several types and causes for the respiratory dysfunction. Let's talk about that mnemonic slow breath. Okay, slow breath. And the S as sedative overdose. The sedatives is used widely in medicine by doctors, for example in some kind of psychiatric disease or some kind of neurological disease and panic disorders. And in these kind of situations, doctors have to use sedative drugs, for example tranquilizers, for example diazepam. Their function is decreasing the function of the nervous system. The nervous system is responsible for regulating the normal function of the lungs. As a result of the sedative overdose, the normal function and the normal rate of the respiratory system will be damaged. As a result, the respiratory acidosis may occur. The second one is L, it's lung disease. For example, COPD or asthma. COPD and asthma is the main cause for the decreasing the normal function of the respiratory system. As a result, the amount of carbon dioxide will increase in our bloodstream. Uh, as a result, the hydrogen ions simultaneously will increase. This may cause acidosis. The next one is obstruction of the airways. Obstruction of the airways may be caused by due to some kind of foreign substances and this kind of things, and its results the same as I mentioned above. The amount of hydrogen ions and carbon dioxide will increase in our bloodstream. And the next one is weak respiratory muscle. Weak respiratory muscle means that the muscles of the rib cage couldn't function normally. It means that we couldn't breathe in deeply and breathe out normally. As a result, the amount of carbon dioxide will increase in our organism. The next one is brainstem injury. Brainstem's function is regulating the normal function of the respiratory system. All of the neurons that's responsible for regulating the respiratory rate is located in the brainstem, especially in the medulla oblongata. Okay, and any kind of injury to the brainstem can cause the devastating injury to the respiratory system. Okay, our next information is respiratory depression. Respiratory depression due to several reasons. For example, in some kind of patients, for example, some kind of myorelaxants, take the myorelaxants, the respiratory depression may occur. The next one's electrolyte imbalance. Don't forget that for normal muscle contraction and breathing out, the muscles have to muscle contract, and for this process, the sodium and the potassium level should be maintained at the normal level. If this normal amount of regulation will damage it, the electrolyte imbalance, for example, decreasing the amount of sodium and potassium, can cause the damage to the muscle contraction and muscle metabolism in the rib cage. As a result, the patient may suffer from the respiratory acidosis. And the next one is acute hyperventilation. Hyperventilation is means that the breathing in and breathing out, that's ventilation, and in some kind of situation the patient may occur the acute onset decreasing the ventilation. It means that the carbon dioxide amount in the blood will increase. And the next most common cause of respiratory depression is trauma to the chest wall. The chest wall in between the pleural layers have the minus pressure. It's the minus pressure's main function is keeping the lungs enlarged. If the minus pressure will decrease due to the trauma to the chest wall, the patient the patient's lungs couldn't enlarge, and it shrinked, and it means that the ventilation couldn't occur normally in this patient. As a result, the respiratory acidosis may occur in the patient. Our last cause is hypoxia-induced bradypnea. Hypoxia-induced bradypnea means that in the patients who are suffering from the hypoxia, the brain stem couldn't function normally, and the patient's blood, the normal amount of acids changed, and the amount will increase. As a result, the respiratory acidosis may occur. All of the information that we are going to give you today is all. Thanks for watching, and if you have any comments and if you have any attitudes and offers for our videos, we are always ready to accept you from the comment section of our YouTube channel. Thanks for watching for one more time.